Welcome to NCLEX Made Easy 91. Let's make NCLEX prep simple, clear, and stress-free with quick tips, rationales, and practice questions. Don't forget to like, subscribe, and hit the bell so you never miss a video.
Stay with us to the end, because the last 5 questions are game changers. Most students get wrong, and it often comes out in NCLEX exams.
Let's get started. Question 1. A client is receiving furosemide IV for fluid overload. Which lab value requires immediate action? A. Potassium 3.2 m/EQ per liter. B. Sodium 139 m/EQ per liter. C. Calcium 9.0 mg per deciliter. D. Magnesium 2.0 mg per deciliter. Correct answer. A. Potassium 3.2 mEq per liter. Rationale. Furosemide is a loop diuretic that leads to the loss of potassium through the kidneys. A potassium level of 3.2 mEq per liter is below the normal range, 3.5 to 5.0 mEq per liter, and may result in life-threatening cardiac arrhythmias, such as ventricular tachycardia or fibrillation. Immediate correction is required to prevent complications. Test-taking strategy: focus on medication effects. When a question mentions furosemide, automatically associate it with potassium loss. Potassium affects the heart, so low levels are a high priority finding. Always prioritize abnormal lab values related to cardiac conduction. Question 2. Which client is at highest risk for hyponatremia? A. A client receiving normal saline. B. A client on a high-protein diet. C. A client on desmopressin therapy. D. A client with uncontrolled diabetes. Correct answer C. A client on desmopressin therapy. Rationale. Desmopressin, DDAVP, is a synthetic analog of antidiuretic hormone, ADH, that increases water reabsorption in the kidneys. This leads to water retention without sodium retention, causing dilutional hyponatremia. Low serum sodium can result in confusion, seizures, and cerebral edema if not monitored. Test-taking strategy. No drug mechanisms. If you see desmopressin, think ADH mimic, water retention, dilution of sodium. Pick the answer that matches this logic. Rule out normal saline, isotonic, and high-protein diets. They don't dilute sodium. Question 3. Which finding indicates that treatment for hyperkalemia is effective? A. Tall peaked T waves on ECG. B. Muscle cramps and twitching. C. Potassium level of 4.8 mEq per liter. D. Absent bowel sounds. Correct answer. C. Potassium level of 4.8 mEq per liter. Rationale. The normal potassium range is 3.5 to 5.0 mEq per liter. A level of 4.8 mEq per liter reflects that hyperkalemia is resolving. Persistent tall, peaked T waves or muscle symptoms would suggest the potassium is still elevated. Normalization of the lab value is the most direct evidence of treatment effectiveness. Question 4.
A nurse notes Chavostick's sign in a client. Which electrolyte imbalance should be suspected?
A. Hypokalemia. B. Hypernatremia. C. Hypokalemia. D. Hypermagnesemia. Correct answer. C. Hypokalemia. Rationale. Chavostick's sign is a neuromuscular response where facial muscles twitch when the facial nerve is tapped. This is a classic sign of hypokalemia, which increases neuromuscular excitability. Low calcium destabilizes nerve membranes and enhances muscle irritability. Test-taking strategy. Memorize key signs of electrolyte imbalances. Chavostick's and Trousseau's signs equals C for calcium. If a question gives a specific named sign, link it directly to the associated electrolyte. Question 5. A nurse reviews lab results for a client with prolonged vomiting. Which imbalance is expected? A. Metabolic acidosis. B. Metabolic alkalosis. C. Respiratory acidosis. D. Respiratory alkalosis. Correct answer. B. Metabolic alkalosis. Rationale. Vomiting leads to a loss of hydrochloric acid, HCl, from the stomach. Since acid is lost, the body becomes more alkaline, resulting in metabolic alkalosis. This can lead to symptoms such as confusion, muscle cramps, and hypoventilation as compensation. Test-taking strategy. Use the vomiting versus diarrhea rule. Vomiting equals loss of acid equals alkalosis. Diarrhea equals loss of base equals acidosis. This is a core NCLEX rule you can always rely on. Question 6. Which assessment finding supports fluid volume deficit? A. Bounding pulse. B. Jugular vein distension. C. Moist mucous membranes. D. Orthostatic hypotension. Correct answer. D. Orthostatic hypotension. Rationale. Orthostatic hypotension is a drop in blood pressure when changing position, a hallmark of fluid volume deficit. Decreased circulating volume leads to poor perfusion and a compensatory drop in BP. Other signs may include dry mucous membranes, flat neck veins, and decreased skin turgor. Test-taking strategy. Look for dry or low-pressure clues. Eliminate choices that reflect fluid overload, bounding pulse, JVD. Go with symptoms of dehydration and low perfusion.
Question 7.
A client with diarrhea is admitted with potassium 2.9 milliequality per liter. Which symptom is expected? A. Muscle weakness. B. Bradycardia. C. Hypertension. D. Hyperreflexia. Correct answer. A. Muscle weakness. Rationale. A potassium level of 2.9 milliequality per liter indicates hypokalemia. Potassium is essential for neuromuscular and cardiac function. Deficiency results in muscle weakness, cramps, and possible respiratory compromise. Severe hypokalemia can also cause ECG changes, like flattened T waves. Test-taking strategy. Connect low potassium equals low muscle function. Eliminate unrelated or opposite signs, e.g. hyperreflexia equals too much activity. Think potassium equals power for the muscles.
Question 8. Which IV fluid is isotonic?
A. 0.45% NCLEX-equality. B. 3% NCLEX-equality. C. 0.9% NCLEX-equality. D. D5W. Correct answer. C. 0.9% NCLEX-equality. Rationale. 0.9% sodium chloride, normal saline, has the same osmolarity as plasma, so it does not shift fluid into or out of cells. It's isotonic. It's used for fluid replacement without altering electrolyte balance.
Test-taking strategy. Memorize IV fluid categories. Isotonic, 0.9% NCLEX-equality, lactated ringers. Hypotonic, 0.45% NCLEX-equality. Hypertonic, 3% NCLEX-equality, D5NS. Always memorize a few examples for each type. Question 9. A client with renal failure has a potassium level of 6.4 milliequality per liter. What is the priority nursing action? A. Encourage fluid intake. B. Administer IV insulin and glucose. C. Place on a high potassium diet. D. Administer sodium bicarbonate tablets.
Correct answer. B. Administer IV insulin and glucose. Rationale. In hyperkalemia, IV insulin is used to shift potassium into cells, temporarily lowering serum potassium. Glucose is given to prevent hypoglycemia. This is a rapid-acting intervention, while longer-term strategies, e.g. dialysis or sodium polystyrene, take effect.
Test-taking strategy. When potassium is very high, always choose the fastest-acting intervention. Insulin plus glucose equals rapid shift. Think speed and priority for critical labs. Question 10. Which client is most at risk for developing hypomagnesemia? A. Client with alcoholism. B. Client with chronic renal failure. C. Client on antacids. D. Client with hypertension. Correct answer. A. Client with alcoholism.
Rationale. Chronic alcohol use impairs magnesium absorption and increases urinary excretion.
Nurse is monitoring a client receiving potassium chloride IV. Which action is most appropriate? A. Administer IV push potassium for faster effect. B. Infuse via gravity with the main IV line. C. Use an infusion pump to control the rate. D. Mix with dextrose 5% in water and bolus. Correct answer. C. Use an infusion pump to control the rate. Rationale: potassium chloride must never be given IV push due to the risk of fatal arrhythmias. It must be diluted and administered slowly using an infusion pump to ensure precise dosing and avoid cardiac complications. Test-taking strategy: when potassium is given IV, always think slow and controlled. Eliminate any answer suggesting IV push or bolus. This is a frequently tested safety principle. Question 12. A client has a sodium level of 128 milliequivalents per liter. Which symptom should the nurse expect? A. Increased thirst. B. Bounding pulse. C. Confusion and lethargy. D. Bradycardia. Correct answer: C. Confusion and lethargy. Rationale: a sodium level below 135 milliequivalents per liter indicates hyponatremia. The brain is particularly sensitive to low sodium, leading to cerebral edema, which presents as confusion, headache, lethargy, and potentially seizures or coma if uncorrected. Test-taking strategy: low sodium equals low brain function. On NCLEX, mental status changes almost always indicate electrolyte imbalance or oxygenation issues. Eliminate answers not related to the CNS. Question 13. Which assessment indicates hypervolemia in a client receiving IV fluids? A. Flat neck veins. B. Weak peripheral pulses. C. Weight gain of 3 pounds in 24 hours. D. Dry mucous membranes. Correct answer: C. Weight gain of 3 pounds in 24 hours. Rationale: rapid weight gain is a sensitive and early indicator of fluid volume excess. 1 liter of fluid weighs approximately 2.2 pounds, 1 kilogram. A gain of 3 pounds suggests accumulation of over 1 liter of fluid. Test-taking strategy: NCLEX loves objective clues. Weight is better than vague signs. A change in weight is more reliable than subjective dryness or pulses. Question 14. A nurse notes Trousseau's sign in a client with pancreatitis. What does this indicate? A. Hyperkalemia. B. Hypokalemia. C. Hyponatremia. D. Hypophosphatemia. Correct answer: B. Hypokalemia. Rationale: Trousseau's sign is carpal spasm induced by inflating a blood pressure cuff and is a classic sign of hypokalemia. Pancreatitis often leads to calcium binding with fatty acids, reducing serum calcium levels. Test-taking strategy: Trousseau's and Chvostek's equals hypokalemia. If you're unsure, look at conditions, e.g., pancreatitis, that commonly cause calcium loss. Question 15. The nurse is caring for a client with a sodium level of 150 milliquals per liter. Which fluid would the provider most likely order? A. 3% sodium chloride. B. D5NS. C. 0.45% sodium chloride. D. Normal saline. Correct answer: C. 0.45% sodium chloride. Rationale: a sodium level of 150 milliquals per liter indicates hypernatremia. A hypotonic solution like 0.45% NaCl provides free water to dilute the sodium and rehydrate cells. Hypertonic solutions like 3% NaCl would worsen hypernatremia. Test-taking strategy: to treat hypernatremia, use hypotonic fluids. Eliminate any answer with 3% or D5NS, which are hypertonic and would raise sodium further. Question 16. A client with chronic kidney disease has the following labs: potassium 6.1 milliquals per liter, calcium 7.9 milligrams per deciliter, magnesium 2.5 milligrams per deciliter. Which electrolyte imbalance is most life-threatening? A. Low calcium. B. High potassium. C. High magnesium. D. All are equally dangerous. Correct answer: B. High potassium. Rationale: although all lab abnormalities are significant, hyperkalemia poses the greatest immediate danger due to its potential to cause lethal cardiac arrhythmias. Calcium and magnesium abnormalities develop symptoms more gradually. Test-taking strategy: prioritize potassium equals heart. When asked about the most dangerous imbalance, default to hyperkalemia unless another condition is clearly more acute. Question 17. A nurse is caring for a client with a nasogastric tube to low suction. Which acid-base imbalance is most likely? A. Respiratory acidosis. B. Metabolic alkalosis. C. Respiratory alkalosis. D. Metabolic acidosis. Correct answer: B. Metabolic alkalosis. Rationale: NG suction removes hydrochloric acid from the stomach, resulting in a net alkaline state, metabolic alkalosis. This is similar to the effect of vomiting. Test-taking strategy: think, what is being lost? If acid is lost, Alkalosis follows. NG suction and vomiting both remove HCl equals alkalosis.
Question 18. A client has a magnesium level of 1.1 milligrams per deciliter. Which symptom would the nurse expect? A. Deep tendon reflexes absent. B. Decreased respiratory rate. C. Tremors and muscle cramps. D. Bradycardia. Correct answer, C. Tremors and muscle cramps. Rationale: hypomagnesemia increases neuromuscular excitability, leading to tremors, cramps, tetany, and seizures. Reflexes become hyperactive, not absent. Test-taking strategy: low magnesium equals everything is overactive. High magnesium equals everything slows down. Think magnesium equals muscle calm. Question 19. Which client statement indicates understanding of sodium restriction? A. I can eat canned soup if I don't add extra salt. B. I will snack on fresh fruit instead of salted chips. C. I can drink broth since it has protein. D. I'll use soy sauce instead of table salt. Correct answer, B. I will snack on fresh fruit instead of salted chips. Rationale: fresh fruits are naturally low in sodium. Canned soups, broth, and soy sauce are very high in sodium and should be avoided on a low-sodium diet. Test-taking strategy: eliminate options with preserved, processed, canned, or packaged foods. Choose fresh and natural foods for sodium restriction. Question 20. Which electrolyte imbalance is most associated with digitalis digoxin toxicity? A. Hyperkalemia. B. Hypokalemia. C. Hyponatremia. D. Hypercalcemia. Correct answer, B. Hypokalemia. Rationale: low potassium levels enhance the effects of digoxin and increase the risk of toxicity. Symptoms include nausea, vomiting, visual disturbances, halos, and arrhythmias. Test-taking strategy: remember the critical digoxin plus low potassium equals danger rule. This is a classic NCLEX combo. Avoid this combo in real patients and watch for it on the exam. Question 21. A client is prescribed spironolactone. Which electrolyte should the nurse monitor most closely? A. Sodium. B. Potassium. C. Calcium. D. Magnesium. Correct answer, B. Potassium. Rationale: spironolactone is a potassium-sparing diuretic that antagonizes aldosterone. It reduces potassium excretion, leading to potential hyperkalemia, especially in clients with renal dysfunction. Unlike other diuretics, for example, furosemide, spironolactone causes the retention of potassium. Test-taking strategy: identify the class of medication. Spironolactone. Potassium-sparing. Always monitor for the opposite of what a loop diuretic would cause. Eliminate electrolytes that spironolactone has no direct effect on, like magnesium or calcium. Question 22. Which finding would the nurse expect in a client with a calcium level of 11.2 milligrams per deciliter? A. Positive Chvostek's sign. B. Increased muscle tone. C. Decreased deep tendon reflexes. D. Tetany. Correct answer, C. Decreased deep tendon reflexes. Rationale: a calcium level of 11.2 milligrams per deciliter is above the normal range, 8.5 to 10.5 milligrams per deciliter, indicating hypercalcemia. Elevated calcium depresses neuromuscular activity, leading to muscle weakness, lethargy, and hyporeflexia, diminished reflexes. Positive Chvostek's and tetany are associated with hypocalcemia, not hypercalcemia. Test-taking strategy: Think high calcium, slow and calm, while low calcium, twitchy and excitable. If reflexes are decreased, calcium is likely high. Question 23. The nurse is caring for a client receiving IV magnesium sulfate for preeclampsia. Which is the priority assessment? A. Blood pressure. B. Serum glucose. C. Deep tendon reflexes. D. Urine ketones. Correct answer: C. Deep tendon reflexes. Rationale: magnesium sulfate depresses the CNS and is used to prevent seizures in preeclampsia. However, excessive magnesium can cause respiratory depression and cardiac arrest. The earliest sign of magnesium toxicity is loss of deep tendon reflexes. Monitoring reflexes helps prevent progression to life-threatening complications. Test-taking strategy. Choose the most sensitive and early indicator of drug toxicity. With magnesium, think reflexes go first, then breathing stops. BP and glucose changes are later signs. Question 24. A nurse is assessing a client with fluid volume overload. Which sound is most likely heard during auscultation? A. Wheezes. B. Crackles. C. Stridor. D. Pleural friction rub. Correct answer: B. Crackles. Rationale: fluid volume overload often leads to pulmonary edema, where fluid accumulates in the alveoli. This produces crackles, rales, on auscultation, especially in the bases of the lungs. These sounds are fine or coarse, bubbling and not cleared by coughing. Test-taking strategy. Connect fluid in lungs equals crackles. Eliminate sounds related to airway narrowing, wheezes, stridor, or inflammation, friction rub. Always match pathophysiology with physical assessment findings. Question 25. Which client is at greatest risk for hyperphosphatemia? A. A client taking calcium supplements. B. A client with chronic kidney disease. C. A client with chronic diarrhea. D. A client on thiazide diuretics. Correct answer: B. A client with chronic kidney disease. Rationale: the kidneys regulate phosphorus excretion. In chronic kidney disease, CKD, the kidneys lose the ability to excrete phosphate, leading to hyperphosphatemia. High phosphate levels bind to calcium, often causing secondary hypocalcemia and can lead to bone demineralization. Test-taking strategy. Always associate CKD equals phosphate retention. Eliminate conditions that either excrete phosphate, example diarrhea, or don't directly influence it, example thiazides. Question 26. A client is admitted with dehydration. Which lab finding would the nurse expect? A. Hematocrit 28%. B. Urine-specific gravity 1.030. C. Sodium 132 milliequivalents per liter. D. Potassium 3.2 milliequivalents per liter. Correct answer: B. Urine-specific gravity 1.030. Rationale: a high urine-specific gravity reflects concentrated urine, which occurs in dehydration as the kidneys try to conserve water. Hematocrit would likely be elevated, not low, and sodium may be normal or high unless water is replaced too quickly. Question 27. A nurse is teaching about potassium-rich foods. Which selection by the client indicates correct understanding? A. Apples, rice, and cabbage. B. Bananas, spinach, and potatoes. C. Toast, lettuce, and chicken. D. Grapes, cucumbers, and carrots. Correct answer, B. Bananas, spinach, and potatoes. Rationale. Potassium-rich foods include bananas, spinach, potatoes, oranges, tomatoes, and avocados. These foods are essential for clients on potassium-wasting diuretics. Options A, C, and D contain foods that are not significant sources of potassium. Test-taking strategy. Memorize high-potassium foods. If bananas or spinach are in an answer, they're probably correct. Use food groups and recall cues. Fruits, veggies that grow under the ground, tend to have more potassium. Question 28. Which client would be most at risk for developing metabolic acidosis? A. A client with vomiting. B. A client with chronic diarrhea. C. A client using antacids regularly. D. A client receiving diuretics. Correct answer, B. A client with chronic diarrhea. Rationale. Diarrhea leads to the loss of bicarbonate, a base. This creates a state of acidosis, specifically metabolic acidosis. Vomiting or excessive antacid use would lead to alkalosis due to loss of acid or gain of base. Test-taking strategy. Follow the GI rule. Vomiting equals loss of acid equals alkalosis. Diarrhea equals loss of base equals acidosis. This is a foundational NCLEX concept that always holds true. Question 29. The nurse is teaching a client with hypokalemia how to take oral potassium. Which statement by the client shows need for further teaching? A. I will take it with a full glass of water. B. I'll crush the tablet if I can't swallow it. C. I will take it with food to reduce stomach upset. D. I will report muscle weakness to my provider. Correct answer, B. I'll crush the tablet if I can't swallow it. Rationale. Many potassium tablets are extended release, and crushing them can cause a sudden release, risking GI irritation or toxicity. The nurse should advise switching to a liquid form or an alternative preparation if swallowing is difficult. 31. Which of the following IV solutions is isotonic? A. 0.9% sodium chloride, B. 0.45% sodium chloride, C. 3% sodium chloride, D. D5W in the body. Correct answer, A. 0.9% sodium chloride. Rationale. An isotonic solution has the same osmolality as plasma, so it doesn't shift fluid between compartments. Normal saline, 0.9% NaCl, is the classic isotonic solution used to expand extracellular volume, especially in cases of hypovolemia or shock. Test-taking strategy. 0.9% NaCl equals isotonic, 0.45% NaCl equals hypotonic, 3% NaCl equals hypertonic. D5W starts as isotonic, but becomes hypotonic in the body. Learn these categories for fast selection on NCLEX. Question 32. A nurse is caring for a client with hypovolemia. Which clinical sign would the nurse most expect? A. Bounding pulses. B. Distended neck veins. C. Hypotension and tachycardia. D. Increased urine output. Correct answer, C. Hypotension and tachycardia. Rationale: in hypovolemia, there's a decreased circulating blood volume. The body compensates with tachycardia to maintain perfusion, but BP may fall due to inadequate volume. Urine output usually drops as the kidneys conserve water. Test-taking strategy: think fluid loss equals low pressure, fast heart. Eliminate signs of overload like bounding pulses and distended veins. Question 33. Which hormone promotes the reabsorption of sodium and water? A. Parathyroid hormone. B. Antidiuretic hormone, ADH. C. Aldosterone. D. Calcitonin. Correct answer, C. Aldosterone. Rationale: aldosterone, secreted by the adrenal cortex, promotes sodium and water reabsorption in the kidneys and potassium excretion. It plays a key role in blood pressure and volume regulation. ADH mainly conserves water only, not sodium. Test-taking strategy: associate aldosterone equals add sodium plus squeeze vessels up BP. Think of the phrase salt-retaining hormone. If the question mentions sodium plus water together, aldosterone is your answer. Question 34. Which client is at highest risk for dehydration? A. A 16-year-old with a broken arm. B. A 25-year-old who exercises daily. C. A 40-year-old with hypertension. D. An 80-year-old with influenza and fever. Correct answer, D. An 80-year-old with influenza and fever. Rationale: older adults have reduced thirst response, decreased kidney function, and are prone to fluid loss from fever or infection. This puts them at highest risk for dehydration, which can lead to hypotension, confusion, and falls. Test-taking strategy: look for age extremes and fluid loss conditions. When evaluating risk, always prioritize elderly plus illness combinations on NCLEX. Question 35. A client is admitted with a potassium level of 2.8 mequicklins per liter. Which nursing action takes priority? A. Place the client on seizure precautions. B. Initiate cardiac monitoring. C. Administer IV calcium gluconate. D. Prepare for dialysis. Correct answer, B. Initiate cardiac monitoring. Rationale: hypokalemia, less than 3.5 mequicklins liter, can lead to life-threatening arrhythmias. Before correcting potassium, it's critical to monitor heart rhythm to detect abnormalities such as PVCs, U-waves, or ventricular tachycardia. Test-taking strategy: always prioritize heart monitoring with potassium imbalances, especially if it's below 3.0 or above 6.0. Seizures are more common with sodium-calcium shifts. Question 36. A client has a serum calcium level of 7.5 milligrams per deciliter. What complication is the client most at risk for? A. Muscle flaccidity. B. Intestinal obstruction. C. Laryngeal spasm. D. Bradycardia. Correct answer, C. Laryngeal spasm. Rationale: severe hypocalcemia, less than 8.5 milligrams per deciliter, increases neuromuscular excitability. One critical complication is laryngeal spasms, which can impair the airway and lead to respiratory arrest. Other signs include tetany, cramps, and Kvostek's sign. Test-taking strategy. Know that low calcium affects the muscles, especially those that control breathing. Laryngeal spasm is life-threatening. Always prioritize airway in NCLEX. Question 37. Which laboratory value indicates effective treatment of dehydration? A. Urine-specific gravity of 1.035. B. Serum sodium of 151 milliequals per liter. C. Hematocrit of 30%. D. BUN of 12 milligrams per deciliter. Correct answer, D. BUN of 12 milligrams per deciliter. Rationale. BUN, blood urea nitrogen, rises during dehydration due to reduced renal perfusion. A BUN of 12 milligrams per deciliter is within normal limits, 7 to 20, suggesting improved hydration and kidney function. A high urine-specific gravity and high sodium still indicate fluid deficit. Test-taking strategy. For lab-based questions, choose normal values that signal improvement. Eliminate any results that are still elevated or indicate concentration of blood/urine. Question 38. Which of the following conditions can result in third spacing? A. Diabetes mellitus. B. Liver cirrhosis. C. Hyperthyroidism. D. Hypoglycemia. Correct answer, B. Liver cirrhosis. Rationale. Third spacing is the movement of fluid from the vascular space into interstitial or non-functional spaces, e.g., ascites. In cirrhosis, low albumin production leads to decreased oncotic pressure, causing fluid to leak into the peritoneal cavity. Test-taking strategy. Look for diseases causing low protein, like liver failure or burns. Eliminate unrelated conditions like diabetes or thyroid problems. Question 39. The nurse notes flattened T waves and U waves on the ECG. Which electrolyte imbalance is suspected? A. Hypercalcemia. B. Hypokalemia. C. Hypermagnesemia. D. Hyponatremia. Correct answer, B. Hypokalemia. Rationale. ECG findings in hypokalemia include flattened or inverted T waves, prominent U waves, and possibly ventricular arrhythmias. These are caused by delayed repolarization of cardiac muscle cells due to low potassium. Test-taking strategy. Memorize key ECG changes. Hypokalemia equals U wave. Hyperkalemia equals tall T wave plus wide QRS. Spotting these on the test can instantly identify the electrolyte imbalance. Question 40. A nurse is caring for a client with diabetes insipidus, DI. Which fluid order is expected? A. 3% sodium chloride. B. D5W, 5% dextrose in water. C. Lactated ringers. D. 0.9% sodium chloride. Correct answer, B. D5W, 5% dextrose in water. Rationale. In DI, the client loses free water in large amounts, leading to hypernatremia and dehydration. D5W provides free water, helping to lower sodium and restore fluid balance. It also becomes hypotonic after metabolism. Test-taking strategy. For DI, think water loss. The treatment is free water replacement, which comes from D5W or hypotonic saline, 0.45%. Avoid hypertonic fluids. They worsen hypernatremia. Question 41. Which of the following electrolyte imbalances is most likely to occur with severe diarrhea? A. Hyperkalemia. B. Hypokalemia. C. Hypernatremia. D. Hypercalcemia. Correct answer B. Hypokalemia. Rationale: diarrhea causes significant loss of potassium-rich fluids from the gastrointestinal tract. This leads to hypokalemia, which can cause muscle weakness, cramping, and cardiac arrhythmias. Potassium is mainly excreted through stool, not urine. Test-taking strategy. Remember, vomiting equals loss of acids, metabolic alkalosis. Diarrhea equals loss of base and potassium, metabolic acidosis, plus hypokalemia. Always connect symptoms to what's lost. Question 42. A client is receiving loop diuretics. Which electrolyte should the nurse monitor most closely? A. Sodium. B. Calcium. C. Potassium. D. Magnesium. Correct answer C. Potassium. Rationale: loop diuretics, e.g. furosemide, promote the excretion of potassium along with sodium and water. This puts clients at high risk for hypokalemia, which can lead to cardiac arrhythmias and weakness. Test-taking strategy. Think loops lose K+. Prioritize labs that influence heart rhythm, potassium first, with any diuretic question. Question 43. Which of the following signs is specific to hypocalcemia? A. Positive Chvostek's sign. B. Bounding pulses.
Question 44. A client's lab result shows serum sodium of 120 millieq per Li. What is the priority nursing intervention? A. Administer IV hypotonic fluids. B. Encourage oral fluid intake. C. Implement seizure precautions. D. Restrict sodium intake. Correct answer C. Implement seizure precautions. Rationale: a sodium level of 120 millieq per Li is dangerously low and puts the brain at risk of swelling, cerebral edema, leading to seizures or coma. The priority is safety and prevention of neurological injury. Test-taking strategy. In severe hyponatremia, 70 cuppers 125 millieq per Li, safety comes first. Low sodium equals low brain function. Seizure precautions are a high-priority intervention. Question 45. The nurse reviews a client's lab report and notes a magnesium level of 1.0 milligrams per deciliter. Which finding is most likely? A. Decreased deep tendon reflexes. B. Muscle flaccidity. C. Hyperactive reflexes and tremors. D. Bradycardia and hypotension. Correct answer C. Hyperactive reflexes and tremors. Rationale: hypomagnesemia, hyper 1.3 milligrams per deciliter, increases neuromuscular excitability, causing hyperreflexia, tremors, tetany, and seizures. In contrast, hypermagnesemia causes depressed reflexes and muscle weakness. Test-taking strategy. Think of magnesium as a muscle relaxer. Low Mg equals twitchy, high Mg equals floppy, hyperreflexia equals low magnesium. Question 46. Which electrolyte imbalance would you expect in a client with chronic kidney disease, CKD? A. Hypokalemia. B. Hyperkalemia. C. Hyponatremia. D. Hypocalcemia. Correct answer, B. Hyperkalemia. Rationale: in CKD, the kidneys cannot effectively excrete potassium, leading to hyperkalemia, which is dangerous for cardiac function. Additionally, calcium may also drop and phosphorus may increase. Test-taking strategy. For renal failure, remember the acronym K-high. Potassium, hydrogen ions, acidosis, inverse with calcium, GFR, low, heme, low, anemia. Question 47. A client receiving potassium chloride IV infusion reports burning at the IV site. What is the first nursing action? A. Slow the rate of infusion. B. Discontinue the IV. C. Apply cold compress. D. Flush the IV line. Correct answer: A. Slow the rate of infusion. Rationale: IV potassium chloride is very irritating to veins, and burning is a common complaint. The nurse should slow the infusion rate, ensuring it's properly diluted and infused via a large vein. Potassium must never be pushed IV. Test-taking strategy. First response equals least invasive. Always choose slow rate before jumping to discontinue unless there's infiltration or phlebitis. Question 48. The client has a phosphate level of 6.5 milligrams per deciliter. What is the most likely cause? A. Hyperparathyroidism. B. Renal failure. C. Alcoholism. D. Vomiting. Correct answer: B. Renal failure. Rationale: in renal failure, the kidneys cannot excrete phosphate, leading to hyperphosphatemia. At the same time, calcium often decreases due to reciprocal regulation. Test-taking strategy. Remember, phosphate up equals calcium down. If both phosphorus and potassium are high, think kidneys. Question 49. Which fluid is best for a client with cerebral edema? A. 0.45% NaCl. B. D5W. C. 0.9% NaCl. D. 3% NaCl. Correct answer: D. 3% NaCl. Rationale: hypertonic solutions like 3% NaCl draw fluid from swollen brain cells into the bloodstream, reducing cerebral edema. It must be given carefully, as it can cause rapid fluid shifts and hyponatremia. Test-taking strategy. When the brain is involved, e.g., hyponatremia or swelling, the answer is often hypertonic. Never give hypotonic fluids, they worsen brain swelling. Question 50. A nurse is assessing a client with suspected dehydration. Which laboratory value supports this diagnosis? A. Hematocrit 50%. B. Bun 10 milligrams per deciliter. C. Sodium 135 MEq par ELI. D. Urine specific gravity 1.005. Correct answer: A. Hematocrit 50%. Rationale: dehydration causes hemoconcentration, which elevates hematocrit levels. A hematocrit grade of 45% suggests decreased plasma volume. Bun also increases, but 10 milligrams per deciliter is normal. Low urine-specific gravity suggests overhydration. Test-taking strategy. Always correlate lab values with fluid volume. Think dry equals concentrated equal. HCT and Bun.
Let's know how many questions you answered correctly by dropping it in the comment section below. If you enjoy this, hit subscribe and like. It helps us make more videos like this for you.
We love you.